quickly update you on where we are as it relates to this pandemic, what the status is, what our current trend lines are, and what that foretells in terms of the future, not just as it relates to the issue that brings us here today, a mobile site that is prioritizing our educators, but also more broadly about our challenges and opportunities to reopen schools all up and down this state, as well as modify our stay-at-home orders as it relates to activities, including youth sports, of which we want to make an announcement today. Just briefly, here's where we are in terms of the vaccine distribution. 6.9 million vaccines have now been administered in the state of California. Just yesterday, we administered 264,000 doses of vaccines, the highest single day number of doses that we have administered since the beginning of our efforts. 6.9 million represents one of the highest numbers of vaccines administered, not only of any state, but of all but 7 nations in the world. We still have more work to do, but the scale and scope and size of the operation that we've built out, the network of over 1,100 providers in all 58 counties in this state, allows for the ability to distribute and administer well over 2 to 4 million vaccines each and every week. That's the goal, designing a system that allows for 4 million vaccines to be administered on a weekly basis. Last week, we were able to administer 1.4 million vaccines. The only constraint now is manufactured supply. I'll repeat that. The only constraint to substantially increasing our administration of doses is the constraint on manufactured supply, both of Moderna and Pfizer, as well as the expectation of new supply coming online as early as early next month, with Johnson & Johnson in the single-dose vaccine that we're very, very hopeful about coming soon with an emergency use authorization. That 6.9 million is important, but what lies underneath it is really the reason that we're here today. And that's the cause that unites all of us, and that's the cause of equity. It's one thing to talk about equity as a North Star, talk about it rhetorically. It's another to deliver on that promise. I've had the privilege of being all over the state of California in the last number of weeks. Was down in Coachella Valley just 48 hours ago. We were in Madera, California, Fresno, other parts of the state, focusing on the issue of equity, reaching out and getting to where people are. One of the principles of the 2 large-scale mass vaccination sites that we announced formally, or at least implemented formally this week with the Biden administration, the 2 first sites of its type in the United States in partnership with FEMA and our California Office of Emergency Services, was a framework of equity. That's why those sites were chosen here in Alameda County and down in East LA at Cal State LA. Up to 6,000 doses will be delivered, or rather administered, on a daily basis at those 2 sites when they're fully operational. But those sites come with mobile components. One of those mobile components, one of 2, and Tammy from FEMA is here, and we thank her for her stewardship and leadership, is focused on the issue of equity as it relates to the issue of education. And we prioritize, and have prioritized now for weeks, the ability for counties large and small to prioritize vaccinations, not only for our teachers, but for our educators broadly defined, our classified employees, our food service workers, our custodians, our bus drivers, the ecosystem that is required to reopening our schools for in-person instruction. By the way, that also includes child care workers, which we've also prioritized. I had the privilege of just 2 days ago to be down in East LA, where there was a set-aside of the allocation specifically for teachers, specifically for child care workers. And it's exactly what this state will be doing now more formally. While 35 counties, and I want to repeat this, 35 counties in the state of California currently are prioritizing vaccinations for teachers and educators. We want to operationalize that as the standard for all 58 counties in the state. So effective March 1st, not only are we doing that through our third-party administrator, but we are also setting aside 10% of all first doses, beginning with a baseline of 75,000 doses every single week that will be made available and set aside for those educators and child care workers that are supporting our efforts to get our kids back into in-person instruction. That's effective March 1st. And the reason we can do that more formally, even though we have allowed for it over the course of the last number of weeks, is the window of visibility into the future with more vaccinations that we know are now coming from the Biden administration. 1.38 million this week with some delays, and I'll talk about that relating to weather. A little over 1.4 million next week, 1.5 plus million the week after. So that stability, that visibility gives us the confidence that we can set aside that as a priority and address the big stress that many counties, many county boards of education, not just counties as it relates to broader health frame, but the county boards of education and superintendents have as it relates to access to vaccinations as a priority in order to get our TK to 2 cohorts of kids back in school first, and then grades 3 through 6, which must be done and must be done much sooner than the current path that we are on, and we believe this will help advance that cause. Forgive me for being so long-winded. I'm going to come back and talk more about reopening schools for in-person instruction after the rest of the speakers, but we do have 2 special people that are here, and perhaps you're wondering why they may be here. Now, they're very familiar to many folks here in the Bay Area. The members both of the San Francisco 49ers, defensive end, quarterback for the Niners, 2 friends of mine I've known for years, but 2 people that give a damn, that actually are really involved in the community, not just involved in the community for photo ops, that do quiet work every single day, that doesn't go unnoticed to folks like me or the people that they're serving. They have been strong advocates, and trust me, they have my cell phone, they know how to get to me, to get youth sports open in the state of California. And they're wondering, what has taken so long to get youth sports competition back in this state? Their friend Kevin, a mutual friend, talking about the realities of mental health, physical health, the fact that kids are not even in school and don't even have the ability to organize around sports. It's impacting them in profound and significant, in many cases, deleterious ways. So we've been looking at the data, looking at the science, looking at best practices all across the country, working with the CDC, working with public health officers at the state level and the local level, and really analyzing the science, looking at the data and transmission. And we are now confident with new guidelines that we're publishing today that we could get youth sports moving again in the state of California, get competition moving again in the state of California with, as always, caveats. None of us naive that despite the fact we've dropped to 3.1% positivity in this state, we were at 9.9% 30 days ago, despite the fact that we have less than 7,000 reported cases today and had 24,000 reported cases 30 days ago. Despite those facts, those very encouraging trends, we still need to be cautious until we reach herd immunity. And so there are components in our reopening plan for youth sports that do require for high contact sports like rugby, like water polo, yes, like football, that we have some testing requirements the state of California will provide for. We will absorb the cost. We will provide those tests. We put out these guidelines in partnership, in concert with organizations large and small, including the Let 'Em Play Coalition, and I want to thank them for their strong advocacy and their support of a process that we've engaged in over the last number of weeks in the give and take in terms of landing on the new guidelines and where we are today. I want to thank members of the legislature, both in the Assembly and Senate, for their advocacy and support as well. But at the end of the day, I want to thank the coaches, the staff, these incredible mentors to these kids. I want to thank these athletes for recognizing what sports did to them and the fact that not only here as athletes, but as wonderful human beings that are also examples to others, because people bend down on one knee to help lift them up, primarily their coaches, primarily the staff, supporting not only their athleticism, but their development as human beings, and recognizing others and recognizing collaboration and recognizing that sports is a lot more than what happens within the lines. It's